Hi, my name is Ashley Kumarnitsky, and this video is for Nursing 335 Leadership. The purpose of this video is to show a reflection of how I met the 8 clinical objectives for this course. I will talk about multiple clinical experiences that I had throughout the semester that helped me in meeting these 8 clinical objectives. The reflection video will also demonstrate how I applied classroom discussion and theory into clinical practice. So the first clinical objective states, utilize previous knowledge of sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I met this clinical objective by signing up for multiple peer leadership clinicals, and I helped underclassmen with their clinical skills. I used past knowledge from 309, 311, 314, and 321. On the clinical floor that day, I helped the underclassmen to prioritize their patients. I helped them with time management, and I also helped them with their assessment skills. At the end of the day, I asked them if they had any questions for me pertaining to their classes, and one of the questions that kept coming up was how to study for pharmacology. So I showed them a template that I had used that helped with my success in pharmacology, and I hope that helped them as well. The second clinical objective states, apply basic principles of management to meet the challenge of an ever-changing healthcare environment. I met this clinical objective on a day when I was with my advanced practice nurse at St. Luke's Quakertown. She was fulfilling multiple roles. She was the interim manager for the med-surg unit and also the ICU manager. Throughout the day, she had to prioritize her time effectively. She had a couple meetings throughout the day to meet with executive officers in plans of opening the new hospital that's going to be opening up in December. So throughout the day, she had to prioritize her time. She was working on payroll, on scheduling, and she also had to visit every single patient on the med-surg unit and the ICU unit. So she had asked these patients how their day was going, they had any concerns, if their call bells were being answered in a timely fashion, if they knew their plan of care, and if they didn't, she would make sure she found the information and she would help these patients. She was also responsible for any type of conflicts that were on the floor and conflict resolution. Also that day, there was a patient who was coming up from the emergency room, and this person had a high acuity of care, and this person needed one-on-one. So on the ICU unit, there wasn't enough nursing staff for the patient to nurse staff ratio. So she had to call staff members to see if they could come in, and fortunately she was able to find somebody, but if not, she would have had to put her scrubs on and then fulfill that nurse on the floor. So that day, everything, kept changing, especially with the emergency room. You never know what type of patients you're going to get who are going to be coming up on the ICU floor, especially if you need a high acuity of care. So stuff is also constantly changing, and you have to be able to adapt to your environment and also move stuff around. You also have to prioritize your time. So the third clinical objective is demonstrate leadership skills through effective use of communication by representing the self, the college, and nursing in a professional manner. I did this by emailing my nurse leaders a week in advance. I told them who I was. I was a Cedar Crest nursing student, and that I was going to be with them that day, how long I was going to be with them, what were my clinical objectives. If I had to schedule a day with like an advanced practice nurse, I gave them a bunch of dates that I was available to decrease the back and forth of communication. I made sure I arrived to the unit promptly, actually early. Made sure I had like a notepad and pencil to take down any questions that I might have had or anything I had learned. And at the end of the experience, I had sent out a personalized email or a personalized thank you to the nurse leaders, thanking them for their time. I also personalized to the experience and also told them what I had learned that day. And then the fourth clinical objective, critically evaluate and disseminate current research related to the principles of leadership and the effects of the healthcare system. So I had did this by finding an article that it was titled Effect of Transformational Leadership on Job Satisfaction and Patient Safety Outcomes. So the purpose of this research was to investigate the effects of nurse managers who use transformational leadership behaviors and how it reflected on nurse job satisfaction and patient safety outcomes. So a transformational leader is a leader who forms relationships with their peers. They motivate them, they empower them, they mentor them, and in turn, workers have shown that they go above and beyond their expectations. So this study used a random sample of 378 acute care nurses, and through the evidence of this study, they had found that the transformational leadership had strong positive influence on the workplace and empowerment, and in turn it increased the nurses' job satisfaction, and it also decreased the frequency of adverse patient outcomes. So that's very important. So it showed that the transformational leadership behaviors are a useful strategy, and it promotes better safety outcomes for both the patients and the nurses, and it also promotes job satisfaction for the nurses. 5, the objective 5 states, function as a competent patient advocate, nurse advocate, and a changed agent. So my peer leadership day, I was on the med-surg unit floor at St. Luke's, and there was a patient who was one day post-op from a surgical procedure from fracturing the leg in multiple places. This patient was in immense pain, and the medication that they were receiving was not effective. I'd advocate the patient's concerns to the nurse and also to the doctor who was doing their patient round at the time, and stated that the medication that was being given is not being effective. Then also I was concerned about the possibility of compartment syndrome. This patient, her blood pressure was through the roof, high heart rate, sweating, had difficult time breathing. I was helping with her breathing that day, and the patient couldn't do anything, and she's just taking the advice of what she can do by the information she's being given by the nurses or by the doctors. I also met this clinical objective on Capitol Hill Day. I learned that from this experience it's important for nurses to speak to their state and local representatives and advocate for their profession and state the concerns that they have in order to bring about change. According to the Pennsylvania State Nursing Association, registered nurses are underrepresented at the state level, and therefore it is important as nurse leaders to advocate for their goals for the healthcare reform and to vote for state representatives that can advocate for them. For objective number 6, formulate plans for continued personal leadership growth and development, and as an independent practitioner of nursing and contributing member of society. I met this clinical objective by going to 4 continuing education classes throughout the semester. The NNA had set up Die and Discuss meetings for an hour monthly, and there were 4 speakers. There was a peds oncology nurse, there was a CRNA, there was a representative for Turning Point talking about domestic violence, and there were, there's going to be 2 nurses who are going to talk about working in prisons. A couple of takeaways I got from these experiences was that nursing is a profession of continuing learning and growth. Even as a seasoned nurse, say a nurse who's been working in the field for 15 years, they are still learning and they're still growing. Also, I learned from the domestic violence Turning Point representative was that if you see or you suspect any type of violence, even though it may not be, it's always good to bring it up to someone's attention and for it to be investigated, because potentially you could save someone's life. I also learned that you sometimes have to get creative in asking patients questions, especially if a patient's in the emergency room and they're with their domestic partner who is being violent towards them. Try to get them to go get like a urine sample and ask them like privately, like, do you feel safe? Because in the presence of the person who is creating the violent action towards them, and if they're there in their presence, they're not going to feel comfortable being like, I'm not safe here at home. So it's very important to seek to make sure everyone is safe, especially children too. For objective number 7, recognize the role of the nurse in policymaking related to the healthcare services at a local, state, national, and global level. So I fulfilled this objective on Capitol Hill Day. There was a PSNA representative that stated that there is a place for nurses in policy making. Right now, the PSNA is proposing safe staffing levels into legislation in hopes to provide good quality and safe patient care. PSNA is also proposing the creation of a Chief Nursing Executive Officer position for the Commonwealth of Pennsylvania to help shape the healthcare environment in PA. The clinical objective number 8 states, predict and describe potential ethical dilemmas within the clinical, organizational, and professional nursing practice. So according to the Nursing Code of Ethics, Provision 3, nurses are to promote and advocate and protect the rights of the health and safety of the patients. I saw a potential brief of confidentiality where the nurse and the doctor were talking about the patient's health history, labs, their plan of care in the hallway, and they kept referring to the patient by the patient's name. This is a public area. Visitors are walking in the hallways, patient rooms are open, and so these patients and visitors could potentially hear, their conversation, and this could be a potential brief of confidentiality. Also, it is unprofessional way for them to be speaking in that manner. They should go either in the patient's room and talk in front of the patient individually about everything and run through everything, or like talk in like the nursing office or something where other people cannot go around here, or instead of saying the patient's name, just say the room number instead. So this is my video for 335, and thank you for listening.